Hello, in this video we are going to survey through all the foramina present in the base of the skull or in the skull base or in the cranial fossa. In the anterior cranial fossa, the very important foramen that you see here, these are the Cribriform plate. The Cribriform plate contains a lot of minute foramina, almost 20 to 25 foramina, and they will be transmitting the cranial nerve number 1. Cranial nerve number 1. The next foramen that you see here, that is the optic canal. It is not a foramen technically, it is a canal because it is a tunnel. This allows the passage of cranial nerve number 2, that is the optic nerve. Along with that, ophthalmic artery. Ophthalmic artery is an important branch of the internal carotid artery. Now, the next foramen that you need to know is actually not technically a foramen again. So, to understand that, we are going to slightly tilt this model, and you can see this long deficiency, and that is the superior orbital fissure. This is called the superior orbital fissure, this one. The superior orbital fissure allows the passage of cranial nerves number 3, that is oculomotor, 4, that is trochlear, and 6. All these 3 nerves are concerned with eye movements, with cranial nerve number 3 having an additional function of pupillary constriction and accommodation. That means parasympathetic function. Okay, that is also a function of cranial nerve number 3. Along with 3, 4, and 6, you also have V1. What do you mean by V1? V is trigeminal nerve. V1, it means the first division of trigeminal nerve. Trigeminal nerve, as you know, has 3 divisions: ophthalmic, maxillary, and mandibular. So the ophthalmic nerve also runs along the superior orbital fissure. It is not the ophthalmic nerve that is running through it. They are the branches of the ophthalmic nerve. For the time being, I'll just name those branches. They are the lacrimal, frontal, and nasociliary. So all these are running through the superior orbital fissure. There are a lot of nerves, 3, 4, 6, and the V1 ophthalmic branches, that is lacrimal, frontal, and nasociliary. And superior orbital fissure is transmitting. Superior orbital fissure and the optic canal is actually communications into the orbit. Okay, there are communications into the orbit. I'm just turning, and you can see the superior orbital fissure here. You can see the optic canal here. Okay, so both of these are basically communications of the cranial fossa to the orbit. Okay, the next opening that you need to know is this. This is the foramen rotundum. Foramen rotundum lodges the cranial nerve V2. V is trigeminal, the second division of trigeminal, that is, it is the maxillary nerve. To see the foramen rotundum more clearly, we'll just tilt it, and you can understand that the foramen rotundum is almost having an orientation that goes forward. Now, where is foramen rotundum reaching? Whenever we learn these foramina, it is good if you know where this is going to reach. Okay, I didn't mention about the Cribriform plate. If we run through this small foramina, you are going to reach the roof of the nasal cavity. Okay, it's very obvious. This is the nasal cavity. The roof of the nasal cavity, you have the deficiencies of the Cribriform plate. Okay, so it is basically, as you know, these are the olfactory nerves that are running through it. So the sense of smell from the nasal cavity pierces the Cribriform plate to reach the olfactory tract, that is olfactory bulb and the olfactory tract that is running in the anterior cranial fossa. So like that, the optic canal and the superior orbital fissure is to the orbit. Just like that, the foramen rotundum is allowing the passage into the pterygopalatine fossa. Pterygopalatine fossa is a little bit tricky, a crevice within the brain. Okay, this region where my cursor now is, that is the pterygopalatine fossa. So just know that foramen rotundum is allowing the passage of maxillary nerve, cranial nerve number V2, from the middle cranial fossa into pterygopalatine fossa. Now, the next very important nerve that is very commonly asked in many of the examinations, including practical or your MCQ examinations, is this. This is the foramen ovale. As you can see, it is an oval foramen. Unlike this, which is a round foramen, this is an oval foramen. Now, what are the structures that runs through the foramen ovale? It is a very famous mnemonic, M-A-L-E. M-A-L-E. M stands for mandibular or cranial nerve. V3. A is accessory meningeal artery. L stands for, very, very important, L stands for lesser petrosal nerves. There are a number of petrosal nerves that we'll learn later, but this stands for lesser petrosal nerve. And E stands for emissary vein. Emissary vein. Okay, this is a very common mnemonic and very commonly asked in many of your examinations. What is male? Okay. Now, where is the foramen ovale going into? Foramen ovale will allow access to the infratemporal fossa. Now, if I put a probe through the foramen ovale from the cranial fossa, if I put a thread down, it is going to reach this place. This is the infratemporal fossa. I'll just kind of navigate through the foramen ovale to make that clear. Okay, through the foramen ovale, I'm going to reach the infratemporal fossa. Okay, this is the infratemporal fossa. I'm now zooming out. Infratemporal fossa. This is the infratemporal fossa. Infratemporal fossa is over here. Okay, so that is where this will reach. Now, the next foramen that you find here, that is the foramen spinosum. Foramen spinosum allows the passage of the middle meningeal artery. Middle meningeal artery is very important. Middle meningeal artery is not an artery that is going to supply the brain, but it is an artery that is going to lie between the inner table or the skull, inner table skull and the dura. Between this, you have the middle meningeal artery. Middle meningeal artery will be located over here. Okay, between the inner table and the dura. So the point is that it is not supplying the brain. It is outside the dura. It is not at all supplying the brain. But the point that all of you should remember is that the middle meningeal artery is extremely prone for an injury if you have a fracture of the skull, especially on the lateral aspects of the skull. A fracture can cause a tear of the middle meningeal artery, and that can cause an extradural hemorrhage, that will have an appearance of a biconvex lens. Okay, because the dura will be stripped off and the hematoma will have convex collection. A convex surface will be seen towards the brain, and this can compress on the brain. So that is the middle meningeal artery, and that artery is ascending up through the foramen spinosum. This is important, and you can even see grooves of the middle meningeal artery on the inner part of the skull. You can see these are all grooves that are seen of the middle meningeal artery. Okay, they are all, if you get an actual skull, you can trace it to the foramen spinosum. To get oriented till the foramen that we learned till now, you please note that there are a crescent of foramina over here. The superior orbital fissure, the foramen rotundum, the foramen ovale, and the foramen spinosum is creating a crescent at the root of the greater wing of sphenoid. This is the greater wing of sphenoid. The greater wing of the sphenoid root, you have this crescent of foramina. You can remember it like SOF and rotundum, ovale, and spinosum, ROS, SOF and ROS. Now, with that, we are going into more larger and more posterior foramina. This foramen that you find here, it's a very, very interesting foramen. This foramen is called the lacerated foramen, also called the foramen lacerum. Now, there are slight difference of opinions when people ask about what passes through the foramen lacerum. The point that you need to know is that foramen lacerum is actually a dried skull artifact. You see foramen lacerum as you see in this model only in a dried skull. Okay, in an actual live person, this will be usually closed by fibrocartilaginous tissues. And only the upper part of the foramen lacerum allows the passage of the internal carotid artery. Okay, this point is important because the internal carotid artery is going to run like this. Okay, run like this. I'll just highlight it like this. It is going to emerge out like this over the upper part of the foramen lacerum. Okay, nothing passes through and through the foramen lacerum, but only through the upper part you have the passage of the internal carotid. Okay, so that is about the foramen lacerum. You also have very minor foramina over here. This is the foramen for the greater petrosal nerve. This is the foramen for the lesser petrosal nerve. I hope you remember lesser petrosal nerve because lesser petrosal nerve was just mentioned in the foramen ovale. Okay, now here if you look carefully at this model, you can see that the greater petrosal nerve groove is directed towards the foramen lacerum, and the lesser petrosal nerve groove is directed towards the foramen ovale. These all have very important significance when we learn about these petrosal nerves, but for the time being I'm going to leave that. Now, I'm going to more important foramina on the posterior aspect. On the posterior cranial fossa, this is the posterior cranial fossa, as you know. Posterior cranial fossa, this is the petrous temporal bone. In the middle of the, almost in the middle of the petrous temporal bone, you have a large foramen. This foramen is the internal acoustic canal or the internal acoustic meatus. Internal acoustic meatus allows for the passage of cranial nerve number 7 and cranial nerve number 8. Okay, 7 is facial nerve and 8 is vestibulocochlear. You should not call it as auditory nerve, you should call it as vestibulocochlear. So vestibulocochlear and the facial nerve. If you read textbooks, you will also learn that you also have the nervus intermedius. Okay, nervus intermedius is basically the sensory root of the facial nerve. Okay, so nervus intermedius, facial nerve, and the vestibulocochlear runs through the internal acoustic meatus along with an artery, and that artery is a labyrinthine artery. All these are in its course towards structures within the petrous temporal bone. It can be the inner ear apparatus, or it can run through the temporal bone and exit out. For example, the facial nerve. Facial nerve is going to run through the temporal bone and it is going to exit out. Next, we are going to learn a very important foramen, and that foramen is this. This is the jugular foramen. The jugular foramen is formed by a peculiar arrangement of the temporal bone here and the occipital bone here. Okay, this is the occipital bone and this is the temporal bone. Both of them are together going to create the jugular foramen. Jugular foramen is not an opening in a single bone, unlike all these. This is seen in the temporal, this is seen in the sphenoid. Okay, unlike that, the jugular foramen is found between the temporal and the occipital bone. Okay, what passes through the jugular foramen? A lot of structures are going through the jugular foramen. The cranial nerves that are running through the jugular foramen are cranial nerve number 9, cranial nerve number 10, and cranial nerve number 11. That is glossopharyngeal, vagus, and accessory nerves are going to go out through the jugular foramen. In spite of that, in addition to that, you also have the inferior petrosal sinus, because this is the petrous bone. So this is the inferior petrosal sinus that is going to drain down and drain out through the jugular foramen. Also, you have this large groove. This large groove is the sigmoid groove through which the sigmoid sinus is going to drain down, and that is also going to drain out through the jugular foramen as the internal jugular vein. So you can see two communications. One is the inferior petrosal sinus and next is the sigmoid sinus, along with 9, 10 and 11 cranial nerves. Very, very important. These are running through the jugular foramen. Next, we have a very important foramen. Again, this foramen is not a foramen, it is a canal, but this canal is notorious to be hiding around here. Okay, it is hiding over here. This is the canal and this is the hypoglossal canal. As you can see, it is not a single foramen, it is a short canal, and this is the hypoglossal canal. Please note that the hypoglossal canal is somewhat related inferior to the jugular foramen. So please note this relation. You have the internal acoustic meatus here, you have the jugular foramen here, and this is the hypoglossal canal. Hypoglossal canal is almost inferior to that. Hypoglossal canal, inferior to the hypoglossal canal, you have the occipital condyle. This is the occipital condyle. I am now looking from the inferior aspect. This is the occipital condyles, which articulates with the C1 atlas vertebra. So just above the occipital condyle, you have the hypoglossal canal through which the hypoglossal nerve, that is the cranial nerve number 12, cranial nerve number 12 is going to exit. Cranial nerve number 12 is going to exit through the hypoglossal canal anteriorly. Okay, so these are the main foramina that you see that are very commonly asked in examinations, and obviously the greatest foramen you should not miss, and that is the foramen magnum that you are seeing here. This is the foramen magnum. Now, we are going to learn about foramen magnum. Foramen magnum can be divided. The contents of the foramen magnum can be divided into an osseo-ligamentous tunnel over here, which contains mainly ligaments and fibrous tissues. Okay, the structures that passes through the here can be remembered by the mnemonic ACT. A is the apical ligament of dens. Apical ligament of dens. C is the vertical band of the cruciate ligament, and T is membrana tectoria. Membrana tectoria is the continuation of the posterior longitudinal ligament of the spinal column. ACT, you can remember by the mnemonic ACT. The posterior part is more nervous. Okay, nervous structures are going to run through the posterior aspect. What are the nervous structures running through the posterior aspect? The medulla oblongata is going to continue as a spinal cord. The vertebral arteries are going to ascend up. The vertebral arteries, the V4 segment of the vertebral arteries are going to ascend up onto the medulla through the posterior aspect. The accessory nerve, now this can be confusing for students. Accessory nerve is going to ascend up. The spinal root of the accessory nerve is going to ascend up. Now you already learned that the jugular foramen contains accessory, so how can here also accessory come? You should remember that accessory nerve is unique. Accessory nerve is arising from the upper segments of the spinal cord, from the upper 5 segments of the spinal cord, and it is going to ascend up into the cranium, and then it is going to leave through the jugular foramen. Okay, so that is the course of the accessory nerve. So you have vertebral artery here, you have accessory nerve, you have the anterior spinal arteries, which has branches of the vertebral artery, and also the posterior spinal artery. These are also running through running through the foramen magnum. You also have the meninges surrounding the medulla on the spinal cord. That is the pia, arachnoid, and the dura mater will also be running through the foramen magnum. Okay. Some textbooks also say the tonsils of the cerebellum. Now, that is technically incorrect. Tonsil of the cerebellum cannot pass through the foramen magnum. Tonsil passing through the foramen magnum or descending down through the foramen magnum is a feature of Chiari malformation, and it is also seen in tonsillar herniation, which is a grave condition, which is a herniation syndrome when an intracranial pressure is increased. In a normal anatomy, the cerebellar tonsil is not a content of the foramen magnum. So these are the main foramina that you need to learn when you learn about the cranial fossa. Thank you.